Assalamualaikum and good morning to all the participants of International Conference on Entrepreneurship Management, Education, Social Science and Technology. I am Dr. Rusnani. Today we'll be present my research title on family needs and their satisfaction in the Intensive Care Unit Hospital University Science Malaysia HUSM Kuban Krian Kelantan, Malaysia. This is my presentation outline. For the introduction, a holistic approach to the critical care nursing required that the family be included in the plan of care. Once the patient has admitted to the critical care unit, an assessment of the family provides the valuable information for the preparation of the nursing care plan. Therefore, this study intends to gain the information about the level of family needs and their satisfaction in the intensive care unit HUSM Kuban Krian Kelantan. The research problem is the family members of the dying patient play an integral role in patient's care in the ICU. Previous research shows that the family support has a major positive effect on the outcome of the patient illness. Therefore, the caring for the family is an important component of the caring for the patient. This can be achieved when the family members are supported and involved in the care of the patient. Furthermore, identifying factors of the family needs and satisfaction are both measuring and improving the quality of the care. The general objective is to determine the needs and the level of the satisfaction of the family in ICU HUSM. A specific objective here first is to determine the most important family needs and their satisfaction. Second, to determine the correlation between the family needs and family satisfaction. The research objective is what is the most important family needs and their satisfaction, and second is there any correlation between the family needs and their satisfaction. According to the laureate 2007, the communication with the family members is an important part of the critical care nurse's responsibility, and appraisal support by allowing the family to visit the patient as well as emotional support from the family are the second important support after the information support. And then the family feel more comfortable and confident if the hospital focus on the patient's treatment rather than the patient's disease, and the effective communication between the medical professional and families is very crucial. Methodology. In the methodology, this is the descriptive cross-sectional study. This population was selected based on a convenience sampling, and the total number of the respondents is 111. The study location is at the HUSM Kuban Krian Kelantan. The study population, the patient's family admitted at ICU. Sampling design convenience sampling. Inclusion criteria is the patient's family came to accompany the ICU, volunteer to participate in this study. Exclusion criteria, respondents who do not volunteer to participate. Now we go to the instrumental tools that you use in this study, divided to part A and part B. Part A for the socio-demographic data, and then part B for the critical care family needs inventory, we call CCFNI questionnaire that adapted from the Malta now 1979 based on the 5 Likert scale from the poor to the 5 excellent. Result of this study found that the majority of the respondent is in age range 30 to 40 years old. Most of the respondent is female and majority of the race is Malay, and for the most religion is Islam, and the occupation of the respondent mostly is employed respondent. For the education level, majority of the respondent from the secondary school, and from the income level is from the range income 2,000 to 3,000 per month. And then most majority of the respondent relationship to the patient majority is brothers. Length of the ICU, majority of the respondent is in length duration 1 to 6 days in the admitted hospitalization. So the admission causes majority because of the diseases. Table 2 shows the correlation between the family satisfaction and family needs. They found that the significant association between the family satisfaction and family needs. Table 3 shows the family satisfaction which concern and caring by the ICU staff. Most of the family satisfaction which concern and caring by ICU staff is 48, very good, and 33 found that excellent, and only one respondent score fair. Table 4 shows that the family satisfaction, which the symptom management, most of the family satisfaction, which the symptom management plan was very good, is about 50, were the top list. However, only 2% of the respondents reported fair were satisfied with the symptom management breathlessness. And then the table 5 shows that the satisfaction of the families satisfaction with the staff ICU treatment to the family. The majority of the family satisfaction with staff ICU was very good, at over the top of the list, and the highest agree percentages is item consideration of your needs, about 37, and give the excellent, and 50 of the respondent give very good. For the item emotional support, concern, and caring by ICU, and skill and competence of the ICU have the similar 34 respectively. Most of the respondents were satisfied with the overall satisfaction. So the table 6 present data was scoring excellent impression. Excellent satisfaction was the consistently of the information 43.2%. Overall, the study found that the family were a total score satisfied 85.41 which their experience in the ICU. Increased visiting time was seen as the strategy to improve the coping skill. The family members of the patient expressed support by allowing the family to visit the patient, as well as the emotional support from the family are the second important support after information support. The conclusion, however, the culture of the family members should not be ignored, and then the family needs and their satisfaction at ICU HUSM are overall met. Hopefully, the information obtained can be used to improve the service provided in ICU. Recommendation here: nurses must have the trusting relationship between the family members and proactive to contribute satisfaction, and more research to gain the knowledge about the family satisfaction, which the ICU. This is my references, which that thank you.